Welcome to an overview of the new guidelines for eye tests and eye charts from the health authorities. Guidelines that are important for everyone in practice and healthcare to be familiar with. Health authorities have published new guidelines for eye tests. This will greatly impact which charts you can use going forward and how you interpret and report vision test results. Vision tests must now be conducted on eye charts that use a logarithmic scale, and vision test results must now be reported in LogMAR values. New requirements are also being set for the eye chart itself, which must be structured as an inverted pyramid, and for the characters and letters you can use. When we change charts and measurement methods, it affects the threshold values we use. For instance, when determining if a child has vision problems that warrant a referral to an eye doctor. In the following, we will take a closer look at the requirements introduced by the logarithmic charts for your eye charts, vision measurements, and reporting of vision test results. But first, let's take a moment to emphasize the need to be more aware of children's growing nearsightedness issues as a result of increasing screen time. It makes it difficult to keep up with the blackboard at school when you can only see somewhat clearly at very short distances. Ophthalmologists and opticians are now reporting 5 times as many children as before showing clear symptoms of pronounced nearsightedness. Here we see 2 typical charts as they are known from many medical clinics and healthcare services. The figure chart, Osterberg and a letter chart. It is clear that they are not structured the same. The size of the figures versus the letters is striking. And on the individual charts, the line spacing varies. The number of figures and letters is even different from line to line. And this makes the difficulty level arbitrary. Had we looked at other charts, we would have seen new variants of filling the whole chart. And that is not exactly the basic rules for constructing eye charts prescribe. It is hard to imagine that vision tests can be performed to give accurate and comparable results with such individually different designs of the eye charts. And when there is obviously not the same difficulty level per line on the individual charts, the vision test result also becomes somewhat questionable. This is now being corrected, with new charts that follow new guidelines. Here you see 2 eye charts from ISOeyes, which are structured logarithmically in an inverted pyramid format. Line spacing and the number of characters and letters per line are the same down the chart. Character geometry, line spacing, and the distance between characters follow precisely defined rules, as described in ISO Standard 8596, rules to which all of EU and other countries like USA and Australia also adhered. Let's take a look at these important basic rules. With a logarithmic scale, the change in difficulty down the lines is not random and dependent on the manufacturer's preferences. For each line we move down the chart, it should be exactly 10 times harder for the human eye to identify the figures and letters on the line. This is the logarithmic system in its simplicity. If this is followed, we can finally start relying on our vision tests. Letters and figures are constructed within a matrix of 5 by 5 cells, with a spacing of 5 cells between them. The distance down to the next line is the same as the height of the 5 cells, and thus the letters or figures on the line. And this continues down the chart. This results in narrower lines that are increasingly closer together. And yes, it gets dense at the bottom, as seen here on charts from our producer ISOeyes, and it must. If we are to continue adhering to the logarithmic increase in difficulty by exactly 10 times.
But doesn't it get so close together that you can't really distinguish the characters from each other? It looks difficult.
Difficult. Yes, exactly. In the real world, visual impressions are complex because the world is complex. To use a modern Danish phrase, you could say the world is crowded, and it's against a crowded world that vision should be measured, not an idealized world where all objects are far apart. Like all charts, the chart for the 3-6-year-olds must be structured logarithmically in an inverted pyramid. The chart must feature easily recognizable and non-filled figures. In the absence of these, simple letter charts such as H, O, T, V and tumbling E charts can be used. The test distance should be 3 meters and the chart should be positioned so that the child's eyes are directly aligned with the eye chart's center. If the angle between the eye and the chart is too skewed, neither the distance nor the perceived size of the characters will be accurate. Here you see 4 eye charts from ISOeyes, all of which comply with the health authority's new guidelines for 3 to 6-year-olds. For school children, the same basic rules apply as for the 3 to 6-year-olds regarding the use of logarithmic scale and construction in an inverted pyramid. The charts can use correctly weighted non-filled figures as well as letters, tumbling E, HOTV and Landolt-C charts. The eye charts from ISOeyes are all weighted relative to each other and therefore provide the same vision test results regardless of which of our charts you choose. The test distance should be from 3 to 6 meters but can be at distances between these extremes. Here again, it is particularly important that the chart is positioned so that the child's eyes are directly aligned with the eye chart center. We operate with a number of threshold values to take action based on the achieved vision test result. Values such as 6-9, which is the threshold for when a child should be referred for further examination and treatment, are well known. The same goes for 6-12, which is the threshold value for being allowed to drive a private car. With the new LogMAR unit, these values do not change, but they will be called something slightly different. The threshold value for referral of preschool and school children will henceforth be LogMAR 02, which roughly corresponds to the old 6-9 measurement, with a slight adjustment to round it to a LogMAR unit. For obtaining a driver's license, it is now LogMAR 03 for private car driving, corresponding to the old 6-12 measurement, while it is LogMAR 01 in at least one eye for commercial driving, corresponding to the old 6/7, 5 measurement. On eye charts from ISOeyes, the transition has been made easier for you. The old and new values are displayed side by side on the eye chart, so you can feel on safe and familiar ground. You are welcome to contact one of our many experienced dealers and get help selecting your new logarithmic eye charts. Also visit our website, ISOeyes.com. There you will find a wide and versatile selection of accurate and logarithmic eye charts in many designs. Surely you'll also find a design and size that fits your needs. In addition, at ISOeyes.com, you'll find a number of guides that give you an easy and understandable transition to a world with logarithmic charts and accurate vision tests. It has never been easier to choose eye charts you can confidently rely on while ensuring compliance with the health authorities' guidelines. Offer your patients, children and adults alike, vision tests that provide a result that both you and the patient can be satisfied with.